Hi, guys. Good to talk to you again. Let me get this kind of arranged correctly. Try to get through with the blood vessels today, and there'll be an assignment that is posted, and it's basically just labeling the blood vessels. So um, let's begin with prayer in the name of the Father, and the Son, and the Holy Spirit. Amen. Dear Lord, give me wisdom to do my work well, humility to deal with my mistakes, and confidence because you have made me in your image. Amen. In the name of the Father, and the Son, and the Holy Spirit. Amen. Um, Try to, I guess, uh, make this as much like I were talking to you directly as possible. Um, so, blood vessels, and again, I'm going to remind you, um, take whatever notes you'd like. You can use kind of shorthand if you'd like. If you want to have the study guide up and kind of be going through it as we proceed, that would be fine. Obviously, you can go back and look at this as you need to study from. You might even just take down some of the vocabulary like this and write it in your own terms. But again, you're welcome to look back at it. I think it'll be more valuable if you at least take some notes. You don't have to take every detail, but if you don't take any notes, then I think it's going to be a little bit hard for you to focus on what we're discussing. So I probably won't linger on the slides long enough for you to take all the notes, so you'll have to pause and write down whatever it is you'd like to write down. So um, arteries are the larger vessels that carry blood away from the heart. Arterioles are the smaller vessels that carry blood away from the heart. Then turning that around, are what uh, venules are what carry the smaller vessels that carry blood away from the tissues, and then veins are the large vessels that carry blood back to the heart. Now, I think there's a should have had this out, I guess, before, but let me find. And then in between are so in the middle of that, you might write capillaries. I think so. The capillary beds are what are between the arterial system and the venual system. Is let's see. I think we have yeah. Um, so this is probably the most effective uh, diagram, and this is on page 318 in your book. But on page 318, so it's showing all of the red. All of the red is oxygenated blood, or pink is oxygenated blood. All the blue is deoxygenated blood. And what we would say is that this is the capillary bed. That's what. So it gets thinner. So the pink thins down to arterioles, and then those become capillaries. That's the capillary bed. And some of those are so thin that they may only allow one red cell to pass through at a time. So they can be very small. And then those capillary beds are emptied by these venules, and then eventually the veins. So again, that's on page 318 that kind of shows that. So the layers of those vessels include the tunica, uh, thin layer of epithelial cells that line that cavity or the lumen. Remember that lumen is this opening. So the opening on the inside is the lumen. So that's what can become blocked with buildup of plaque. Should have left this open because I think the vessel diagram that would be helpful for you to look at would be on the right page, page 326. So this would be a good diagram for you to look at, showing those layers. And again, then in between you have the capillary beds showing that. So that's another valuable diagram. So the lining of the lumen, the lining of the inside of the vessel, That would be the tunica intima. And then the tunica media is the smooth muscle and the elastic tissue that allows it to expand and contract. So vasodilation and vasoconstriction. Contraction of the muscle narrows the lumen or would cause what's called vaso or vessel constriction. And then we have the tunica externa, which is the outside, maybe kind of the fibrous connective, kind of the tougher outside layer. So you have the inside that lines the tube. Then you have the muscular layer that allows for expansion and contraction or dilation and constriction. And then you have the outside that's just kind of a covering, the tunica externa. Okay. Comparisons of arteries and veins. Arteries have a thicker tunica media. And basically what you're saying by that is that arteries have more muscle, and veins are basically just the tubes that are returning. And you might think about that kind of like plumbing, and although you're probably not all plumbers are familiar with that, but your supply lines in your house in water, they're kind of under pressure. But the drain lines, the sewer lines, that's more of a passive flow, just a gravity flow. So they're not under as much pressure. Though that's a little bit the way that the plumbing of your body is. The arteries that are supplying the blood, those are kind of under pressure. That can be tighter. The veins returning the blood, it's going to be under less pressure. Veins are thinner. They have a larger opening. They're just allowing the blood to come back. But they do have valves that prevent backward flow. And so those valves, if the blood was going, let's say that, it'd probably be better if I did it this way. So let's say that the blood is coming from my legs back up toward my heart. As the blood from the pressure of your arteries gets pushed through, it can open those valves up, and then they close, and the blood can't come back down. That's the way those valves are. Now, those valves can fail. And when those valves fail, it can cause this condition, which probably all of you have seen. It probably happens more often in age, and it happens probably most often in the legs. But those are what are called varicose veins. And so you have this pooling of blood in the vessels. And what's happened is those valves that are supposed to hold the blood up have failed. And so you have this pooling of blood in the vessels. And although the blood still moves through the vessels somewhat, it's not as efficient as it could be. Okay, the physiology of, get in the right spot here. The operating status can be measured by arterial pulse, expansion and recoil of the arteries as the blood is expelled from the heart. And that's really what you're testing with regard to blood pressure. You're testing the pressure that's in those vessels away from your heart. Measured at 9 pressure points. Your pulse can be measured at a number of different spots. Now, you're probably familiar with several of those. I'll give you a few seconds to think of those. Just think through where are some of the places that you've seen people take their pulse. And so here on page 335 is a diagram of the places where those are most likely taken. So the two that probably look the most familiar to you would be your radial artery, which is there by your wrist, and then the carotid artery, which is in your neck. Those are probably the two places where you feel it the most. But sometimes if your heart rate is really elevated, you may feel a pulsing in your temple. You may feel a pulsing in some of those other spots where your arterial pulse can be measured. So those are called pressure points where your arterial pulse can be measured. Normal is 70 to 76. Activity, postural changes, meaning standing up and sitting down, or even emotionally. Your heart can race due to emotions. Probably the thing that you're most familiar with is the fact that when you're active, your pulse is going to increase. And we did a little bit of that with the lab activity. Okay, blood pressure. Blood pressure is exerted by blood on the walls of the vessel. The elasticity and recoil of the arteries allows blood pressure to maintain a continual flow of blood during contraction and relaxation of the heart. So let's see if hopefully this link works. We'll see here. Looks like it's going to, so we'll take a look at this video. This is not part of it.
High blood pressure, or hypertension, is a common condition in which the force of blood on the walls of your arteries is often too high. Arteries are the blood vessels that carry blood away from your heart to supply your tissues with oxygen and nutrients. In your heart, two chambers, called ventricles, contract with each heartbeat to push blood to your lungs and through your arteries to your body. As blood flows through them, three main factors affect the pressure on your artery walls.
Okay, think about that a little bit. What are those things that are going to affect blood pressure? What are the things that are going to determine the amount of force, the amount of pressure that your blood's going to exert?
The first is cardiac output, or the amount of blood your ventricles push out of your heart each minute. Your blood pressure goes up as cardiac output increases. The second factor affecting your blood pressure is blood volume, or the total amount of blood in your body. Blood pressure also goes up as blood volume increases. The third factor that affects your blood pressure is resistance, which is anything working against the blood flow through your arteries. Several factors contribute to resistance.
Okay, now I'll give you an example. Resistance, the amount of resistance would have to do with how big the vessels are, if there are any blockages in the vessel, all those kinds of things. And again, you could use plumbing kind of as an example. If there's something partially blocking it, there's going to be an increased resistance. It's having to move around that. If you have a more constricted, let's say, garden hose, a smaller garden hose, it's going to be at a higher pressure.
One resistance factor is the flexibility of your artery wall. Healthy arteries expand with each heartbeat to help reduce blood pressure on the wall. Another resistance factor is the diameter of your arteries. Your body is able to increase the diameter of your arteries to lower your blood pressure, or reduce the diameter to raise your blood pressure. A third resistance factor is blood viscosity, or thickness. In your blood, more particles, such as proteins and fat, increase viscosity. If your blood is thicker, your blood pressure goes up as your heart works harder to push it through your arteries. Your blood pressure can be measured with a device called a sphygmomanometer, or blood pressure cuff.
Sphygmomanometer. Manometer just means pressure, but this is blood pressure in particular. And I don't know if you're familiar with how that, I'm sure all of you had your blood pressure tested, and I don't know how familiar you are with it. But basically what that cuff is doing is creating a pressure on the outside of your arm, and blood won't push past that cuff until the pressure in the cuff drops to the point where the pressure in your blood is greater than that. So that's how that works. If you're ever wondering why, so they pump that up tightly, squeeze your arm, and then start letting pressure off of it. And as soon as your blood can push past that, the technician can hear the blood moving through, can hear your pulse again. So that was the high end. It's the highest pressure.
When your heart beats, the pressure of blood on the walls of your arteries is called systolic pressure.
That's the maximum.
When your heart relaxes between beats, pressure on the artery wall is called diastolic pressure.
That's the minimum.
While your blood pressure may change throughout the day, it should normally be less than 120 millimeters of mercury for systolic pressure and less than 80 millimeters of mercury for diastolic pressure. If your systolic pressure frequently stays above 140 or your diastolic pressure frequently stays above 90, you have high blood pressure. Over time, high blood pressure will damage the walls of your arteries. Your artery wall may become weak and form an enlargement called an aneurysm, or the wall may burst and bleed into the surrounding tissue.
You're probably all familiar with that condition. You've probably heard of people having an aneurysm, and that's what they're describing, is when you have that bulging in the vessel due to extreme high blood pressure.
Small tears in your artery wall may attract certain substances in your blood, such as cholesterol, fat, and calcium, to form a buildup called a plaque. Blood flow through your artery decreases as the plaque enlarges. Blood cells can stick to the plaque and form solid clumps called clots, further reducing or completely blocking your blood flow. Damage to your arteries raises your blood pressure even more by making your heart beat more forcefully. Artery damage and reduced blood flow lead to conditions such as a stroke, heart attack,
sometimes called a
or
CVA,
kidney
stroke,
disease.
cardiovascular accident.
In most cases, the cause of high blood pressure or hypertension is unknown. This type of high blood pressure is called primary or essential hypertension. Treatment for essential hypertension includes lifestyle changes, such as eating a healthy diet. If you are sensitive to the sodium in salt, your doctor may recommend limiting your intake of salt and highly processed foods.
That's probably the one you've heard the most about. You're probably familiar with people that have blood pressure issues and they watch their sodium intake.
Sodium may cause your body to retain water, which increases both your blood volume and your blood pressure. Other lifestyle changes that can reduce blood pressure include avoiding excessive alcohol intake, getting regular exercise, losing weight if you are overweight, and quitting smoking. Your doctor may also recommend medications that act on your kidneys, blood vessels, or heart to help reduce your blood pressure. Diuretics, commonly called water pills, cause your kidneys to move more salt and water from your blood into your urine.
So that's lowering the blood pressure by lowering the blood volume,
which reduces your blood volume and pressure. Beta blockers reduce the workload on your heart by decreasing both the rate of your heartbeat and the strength of your heart's contractions. Several types of drugs act directly or indirectly to reduce your blood pressure by relaxing your blood vessels, which increases their diameter. These drugs include ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, and direct-acting vasodilators.
A vasodilator means something that makes the vessel larger. Okay. All right. So, oops, let's stop this little video. Okay. So that's a pretty good summary of blood pressure. So continuing with that, okay, the elasticity and recoil of the arteries, the way that they can come together and that's the high and low. Remember, the diastole and systole. Okay, blood pressure is highest in the arteries. We already talked about that. it gets to near zero or negative in the veins near the heart. So when it's emptying into your heart, it's virtually under no pressure. It's just dumping in there without much force. The return of venous blood is facilitated by the vein structure, the fact that it has a large opening and it has valves. That both of those things help the blood make its way back to the heart with really under minimal pressure. Now, there is also this force of when your skeletal muscles, which are adjacent to these vessels, when they're contracting and relaxing, it helps facilitate the movement of blood. That's called muscle milking. The decrease in thoracic pressure when we inhale, so when your diaphragm drops down, it enlarges, and that pressure becomes less inside your chest cavity. It causes the veins near the heart to expand and fill with blood. The net effect, and I don't like the term sucks it in because it's really a difference of pressure, but it creates a low pressure area whereby the high pressure area can force the blood in. There isn't really any force such as suction because fluids can't really pull on each other, but it creates a low pressure, creates a pressure gradient or a pressure differential where the blood gets pushed into the heart. Okay, measurement of blood pressure, and the narrator of the video did a pretty good job of describing this. I'm not going to spend a tremendous amount of time, but the systolic pressure is the peak at contraction. Diastolic is at relaxation. It's expressed in millimeters of mercury. And if you remember when you're in 8th grade, we talked quite a bit about this with barometers. That's the way a barometer works. So a barometer can hold up a column of mercury. Normal air pressure, it's I'll give you the right number, 760, I think, millimeters of mercury. So about 3/4 of a meter. So between 2.5 feet or something, like maybe a little bit more than that, of mercury is what it can stack. So that's what we mean when we say it's expressed as millimeters of mercury. How tall of a column of mercury, which is a really heavy liquid, can it hold up? Can that pressure hold up? So normal is 120/80. You'll have to know that. And that's, again, the high number and low number are at contraction of the heart, when it maximizes, and then at relaxation of the heart, when it minimizes. Okay, cardiac, so it's the result of cardiac output, how much blood there is. So the more blood your heart's putting out, the higher your blood pressure. The lower amount of blood that your heart's putting out, the lower the blood pressure. Peripheral resistance, friction encountered, and that friction can be due to the size of the vessel, the flexibility of the vessel, and the blockage in the vessels, which I had this is showing kind of how plaque can build up inside there. So that yellow stuff, it's kind of fatty plaque that shouldn't be in there. But the more of that there is, the less efficiently and effectively the blood can move through. That's peripheral resistance, meaning as it moves out into the periphery of your vessels. Okay, and it's increased by vasoconstriction. That's talking about blood pressure. Blood pressure is increased by vasoconstriction. If the tube gets smaller, there's more pressure. It's decreased by vasodilation. So if the vessel gets larger, there's less blood pressure. How does it get regulated? Well, the sympathetic nervous system causes specific vasoconstriction, except in the brain and heart. Occurs with blood loss, fight or flight, posture change. So all of those things can cause a change in blood pressure. Specific vasoconstriction, so the pressure of your blood can increase in particular places. Kidneys. The way that your kidneys are involved is by how much fluid you retain. If you're getting rid of a lot of fluid, that's going to cause your blood pressure to go down. If you're retaining fluid, it's going to cause your blood pressure to go up. So you're going to get rid of blood volume, get rid of water, salt, and then water, because water follows solute, which we've said a number of times. When your pressure is high, when the pressure is low, when the pressure is low, you're going to retain more water. When the pressure is low, the kidneys will release renin. Okay, and that's an antidiuretic. That means you're going to keep extra water, and that triggers angiotensin, which is a vasoconstrictor, and aldosterone release. So those are all things that are when your pressure is low to increase the pressure. Another factor is temperature. Cold temperature causes vasoconstriction, and that's a way that your body uses to conserve body heat. Because the more blood you have out in your periphery of your body, the more your body temperature is going to drop with cold temperatures. If you're warm, it causes vasodilation. That's why you end up reddened. Because all that blood, there's more blood in your periphery, and it's can be nearer the surface of your body, so you can get rid of that extra heat. Chemicals, epinephrine and nicotine can cause vasoconstriction, and the lady in the video shared with us that smoking causes hypertension, and that's why, because it causes vasoconstriction. Histamines and alcohol can result in vasodilation short term, but has negative effects there. Blood pressure disorders. Hypotension, too low of blood pressure can be the result. It's not too low if it's the result of good fitness or conditioning. But if it's acute, it warns of circulatory shock. Circulatory shock means your volume gets so low, your blood volume, the blood pressure gets so low that you're not able to move blood through your body. And that's what, with blood loss, that's a concern, is circulatory shock. There's not blood actually moving through. Hypertension is, as the lady in the video, the narrator said, 140/90. And sometimes it's referred to as a silent killer because it progresses without symptoms and it can damage the heart and the vessels. Being under too much pressure can cause damage. Okay, capillary exchange. This is going to be important not only here, but as we go in, move into the next chapter, which is what happens in your respiratory system. But you have passive diffusion. Things are going to move from high to low concentration. So things leave capillaries by diffusion through the membranes or by endo or exocytosis. So if it's larger things, it's going to be by endo or exocytosis. That's where it forms a vesicle that moves to the edge and then opens up and moves larger things in or out of a cell, or in this case, of the vessels. But the gases, like respiratory gases, primarily that's going to be the result of simple diffusion. So at your tissues, well, let's start at your lungs. At your lungs, the air you breathed in is high in oxygen. The blood coming back from your body is low in oxygen. So oxygen is going to diffuse into your blood. It's going to go from high in your lungs to low in your blood. Carbon dioxide is returning from the respiration that occurred in your tissues. So your blood has high carbon dioxide. Your lungs have low carbon dioxide. So the carbon dioxide is going to move from your blood into your lungs to be expelled, because it's going also from high to low concentration. You can also have movement through what are called intercellular clefts, means gaps between the cells. Fenestrated capillaries, those are pores in the capillaries. I don't know if we have diagrams of all of that. Yeah, that's on 343, I think. So that's showing movement in and out. This diagram on page 343 is showing how things move in and out. Page 343. So that's showing the options kind of how things can move in and out of the blood. Okay. So this is, just to be clear, this number 2 is passive diffusion was one way, and hydrostatic pressure. Blood pressure actually pushes the fluid and solute out of leaky capillaries on the arterial side. So the pressure of the blood's pushing stuff out of the blood and into the arterial side of the capillary bed. And then osmotic pressure, the plasma proteins, pulls fluid back in on the vein side. So osmotic pressure means it's going from where there's more water to where there's less water, and it's going to pull the fluids back in. Okay, movement is determined by the difference in the two pressures. Again, high to low. Now we have just a little bit more about the lymphatic system. And the lymphatic system is shown on page 345. And you're probably aware of where the places where you have a concentration of lymph nodes. And you can see that on this diagram. You can see where there are a lot of lymph nodes in your neck and in your armpits and in your groin are three of the large areas where you have. And your lymphatic system basically is picking up the excess fluid. So you have the particulate part of your blood, and then you have just the fluid part of your blood, and it gets returned. That excess fluid gets returned to the circulatory system via the lymph system, and the lymph gets filtered, and that happens at the lymph nodes. And those cells are part of the immune system, and that's why you get swelling sometimes under your jawline if you have, some sort of a throat infection or maybe even a upper respiratory infection of some kind. You'll get your lymph nodes under your jaw will extend, and I'm sure most of you have experienced that, and they can become very tender. That can also happen in your armpits or also in your groin when you have an infection. And that's one of the ways that, when you go to the doctor, oftentimes they'll feel up under your jaw. They might feel under your arms too, but they'll feel under your jaw just to see if you're carrying an obvious infection, because if your lymph nodes are swollen, they can tell something's wrong. There's some sort of a probably bacterial infection that's going on. Okay, so they also have what are called macrophages, things that eat large particles basically, and lymphocytes that attack and make antibodies. The vessels empty into the right lymphatic duct and the thoracic duct. And again, if you look at this diagram, it's probably the best way you can see that. Both empty into what's called the subclavian vein, and the subclavian vein means that it's underneath your clavicle, right? Subclavian, under your clavicle or your collarbone. So the subclavian vein, and that's one of the veins you'll have to actually identify on that assignment where you're using the word list and so on. Okay? And guys, there are a couple videos on here that are Bozeman circulation and circulatory system. And I would highly encourage you to watch those. I think he does an excellent job of explaining things. I'm not going to make that part of this video. It just gets more lengthy, but those are all on YouTube. They're easy to find. They're easy to watch. You can fast forward through the parts that you don't think are that interesting, but I think he does an outstanding job of explaining things. So that would be a good addition to what we're doing here. Now, the thymus gland is pointed out here, and we talked about that. Just that's in this diagram also. It shows the thymus gland right there in this smaller diagram. Oops, sorry, I'm going the wrong way. Okay, and it creates thymosin. Tonsils are part of that lymphatic system, trap and remove foreign materials. Peyer's patches, which are in the gut, they do the same function, except they do that for kind of your digestive tract or your small intestine. Okay, and all of that is part of the mucosa-associated lymphatic tissue, called referred to as the MALT. And also, mention one other thing here. Oh, I was just going to read you, because there's not much. There's only a little bit about cleaning blood and storing platelets in the spleen. I was going to read you just a little bit that part. The spleen is a blood-rich organ that filters blood. It's located on the left side of the abdominal cavity and extends and curls around the anterior aspect of the stomach. Instead of filtering lymph, the spleen filters and cleanses the blood of bacteria, virus, and other debris. Its most important function is to destroy worn-out red cells and return some of their broken-down parts to the liver. Iron is, for example, iron gets used again to make hemoglobin. The rest of the hemoglobin molecule is secreted as part of bile, which is part of the digestive process. Other functions of the spleen include storing platelets and acting as a blood reservoir. During hemorrhage, both the spleen and liver contract and empty their contained blood into the circulation to help bring the volume back to normal. So it's a little bit of a reservoir for blood. And it also says that in the fetus, in the developing child, the spleen is an important hematopoietic, meaning blood cell forming site. But once you get to be an adult, it's only forming lymphocytes. Okay, and that brings to a conclusion the lecture portion of the chapter. There are going to be a couple of things. I'll continue to post some things on Google Classroom, but please watch the entirety of this. If you need to go back and watch a little bit more of it, that'd be fine. You need to fill out the thing that has all the vessels, which should be up, and then finish the study guide, which is on there. So good luck with all that, and blessings to you. Hopefully you continue to do well. And if you have questions about anything, please let me know. And also understand, again, as I told you in the previous video, I'm going to try to keep this fairly low pressure. I want to expose you to the material because I think that's what you need to have. And we need to feel like we're making progress along those lines. But you're going to have materials to complete things. I challenge you to challenge yourself to commit some of this to memory rather than just make it kind of a practice of looking up and writing down. Try to spend some time making all this kind of mesh together. So blessings to you and your family. I hope all is well, and I look forward to talking to you again soon.